So everyone, it is 2:01 Central Standard Time. This is Jennifer Waller. I am the Executive Director for ASCA, and welcome. I know we still have participants coming on. So I know folks will continue to join. We do have closed captioning happening. If you need to turn that on, I think it should be at the bottom of your screen. And so feel free to follow along that way if you need to. We do have the question and answers open, as well as I think the chat is on as well. Our goal here is to make this a dialogue. And so we really didn't put together a huge formal conversation. We really wanted to take the opportunity to just have a conversation. We hope that there's probably going to be more questions than answers. But I think definitely things for you all to think about as you're working on your campuses, to think about what reopening looks like. I think we've gotten a plethora of information about what schools are doing, but I think the reality is that nobody really knows, and we won't really know until maybe July, maybe August. Yeah. Things keep changing on a daily basis. So on that note, I'm actually going to turn it over to Sean, who's going to serve as our facilitator for this discussion. And then I'm going to blank out my screen so that I can keep typing and not be a distraction to you all.
Great. Thanks, Jennifer. Good afternoon, everybody. Appreciate you joining us for our webinar here, and really appreciate both ASCA and ACUHO-I for putting this together, really to give us an opportunity to talk about some of the challenges we have. I mean, it feels like, you know, the list of challenges is longer than we can sometimes keep in one place, in terms of how we look at the upcoming academic year and look at this summer and really beyond that. But, you know, really, as we look at, you know, the prospect of reopening our campuses, and with the idea of that looking very differently, we wanted to have an opportunity to talk about that from a student conduct and housing perspective. And, you know, what are things that we need to prepare for? What are some changes we need to do ahead of time? And just really is kind of, how do we change our mindset walking into this new environment for higher ed, which will look very different. We were joking prior to everyone joining us that, you know, this is not a Title IX webinar, so doesn't mean we won't mention it at some point, but it is not a Title IX focused webinar. So I know there's been a lot of those going on for everywhere for very good reason, but this will be a little bit different in focusing on some of our general conduct issues, particularly within the residence. So the way, and again, to introduce myself, my name is Sean Gallagher. I'm the Chief Compliance Officer at Manhattanville College in Westchester County, New York, though I am broadcasting from lovely Milford, Connecticut. And before we jump into questions of what we're talking about, I'll let each of our panelists introduce themselves. So why don't we start with you, Doug?
Good afternoon. I am Douglas Bell. I'm the Associate Director of Residential Life here at the University of Houston.
I'll just go in the circle. You want me to go next? I'm Scott Schneider. I'm a partner with Hush Blackwell Law Firm in Austin, Texas, and I'm happy to have everybody in my library.
Hi, I'm Jocinda Hudson. I'm the Assistant Dean for Student Affairs at the Stetson University College of Law in Gulfport, St. Pete, Florida.
Hello, everybody. I'm John Lauer. I serve as Associate Vice President for Student Life at Colorado College, and I'm also a member of the Future of Housing work group that ACUHO-I has put together. And I'm chairing a subgroup on risk management, liability, and communications. So.
Great. Well, thank you, everybody. And so what we'll do is I have a few prompts. We'll put some questions out to the group. If you have questions, I know there's a couple that have already come through. Please use the Q&A box. So as our panelists talk, I will be kind of curating some of the questions that pop through and see if there are note ones that may be good ones to throw out to our group here. So I guess to start off in a really general fashion, you know, when we think about reopening campus, and that's really such a big question, and a lot of us here are working on that right now in terms of how we do that in the right way, if we can. That's still an open question too. What do you think are some of the top priorities for housing and conduct professionals to consider as we start this process and go into the academic year?
Look, I'll start off. Yeah, this is, at least for me, and I'm so worn out and tired, so it may not be my best performance, but yeah, I would say the last 4 weeks, the work I've been doing with schools has almost all been around, what does this look like from a risk management perspective? And the assumption is, I think, for virtually all the schools that I do work for, and some of this is very regional, especially places that haven't been as hard hit by this, that the expectation is, look, we're going to be open. And what does that look like? To me, I think, one of the interesting things, and I'm already seeing like some questions around this for you all as conduct professionals to be thinking about. One of the conversations, for instance, is about wearing masks and risk mitigation associated with wearing masks. And, the question gets framed in some of these conversations about, well, should we have a rule? And the kind of one of my pushbacks is, it's like, you can have all the rules in the world. Who is it that is going to have to enforce these rules? And so I think it's especially, I'm hearing, having conversations with a lot of people at very high levels about what reopening looks like. And I always try to take it back to, if we're going to have certain expectations around social distancing in residence halls, mask wearing on campus, social distancing in the campus as well. If we're going to have those rules, are we getting input from the people who would be tasked to, in essence, enforce those rules? And what are they saying about whether or not that's feasible and practical, whatever the case may be? So to me, that's one of the big issues for your groups.
Great. Anybody else want to jump in on that? Any other priorities?
I think it's similar to that, or on the same thread, is trying not to be out in front of your institution and communicating, and trying to figure out how to have the important conversations in-house, and then figure out how your institution will speak with one voice, so that the messaging doesn't get bifurcated or trifurcated by the various audiences that are just waiting to hear a specific answer to their question, and then get a commitment out of somebody who might be in conflict with your perspectives, either in the housing or conduct realm. And we just have to realize that people are going to be seeking their answers. And if the institution says, we'll have that answer for you in a little bit, they're going to reach out to other elements of your campus and ask the question and try to get the answer. So as much as you can, to be working as an institution to speak with one voice, but be able to create the internal conversations that you have to have. Because Scott's point is spot on. To pledge you're going to do something, you have to be able to do it. And if the people that are going to do it can't do it, you want to know that before you've announced that that's your new policy or practice or standard.
Sean, when I'm looking at this, I'm thinking of this as a very complex. When you're looking at conduct, there is so many things that students are concerned about going into it, not only about their status as students, but also now they're worried about their health, they're worried about the new Title IX things. But when you're looking at housing, housing is so unique to each campus at times. Housing units look so different. Housing missions can be so different on campuses. Looking at the safety, the perception of safety, how we communicate our wellness models and how we communicate kind of our health and safety plans, I think, to students, parents, and guests. What I foresee is in the fall, my campus, we're going to be very different to guests and visitors to campus. We have a law library that's been open to the community for many people to use over the years. I don't think that's going to happen anytime soon. And so I think that looking at the uniqueness of your campus, but then also having contingency plans, because things will happen that you never guess. And so that flexibility and that understanding and that being able to respond, and that is a play of multiple scenarios of how this situation is going to go down in the next couple of months. It takes a lot of work, yes. But I think that we have to be prepared for a couple of different things. Right now, as I'm planning for fall opening and orientation, I've got 3 different scenarios I'm working with. One on campus, one hybrid, and one totally online. And I think that that's what a lot of people are looking at when you're talking about how are we going to do different things as far as training conduct committees. Training RAs, training our peer ambassadors. I think that that's some of the things that we should be talking about now, if we can, and planning ahead.
Yeah, and I'll piggyback off of what Jocinda was saying. I think one of the things will be really critical is just really considering the health and safety of your students, but also thinking about how you're enforcing some of these policies. You know, within residential life, a lot of your policy enforcement is done by students. So how are they going to be entering these rooms? What type of safety protocols are you going to have for students to intervene in such situations? That's some of the things that we're currently considering here at the University of Houston, of how do we interact with students and intervene with different policy infractions, but also maintaining that good social distancing model. So I think keeping the students safe should be paramount, but as Jocinda said, it's going to be very complex and it's going to look different at different institutions. Here at the University of Houston, we did not close. So we have essentially had a dry run at how our fall is going to look, because we housed about half of our students remained on campus when the initial pandemic hit. So we're still kind of navigating on how we're going to kind of operate in the fall.
Right. I mean, those are all good points, and maybe kind of tying into some of what you've all said. You know, there's this issue of, you know, communication and how this information is provided to students. But, you know, part of the way we communicate too is through our policies, and and keeping Scott's enforcement point in there. You know, we have, you know, most institutions have our tried and true codes, which we, you know, go through revision processes. But, you know, right now we're probably seeing a bigger focus on certain areas of the code that have usually been considered kind of the mundane parts of our code of conduct, like failure to comply with a college official, like unauthorized access to a particular area, you know, just, you know, or sometimes you have the kind of the broader code language of things like endangering the health and safety of somebody, somebody, you know, and I'm, you know, even though I don't do the day-to-day stuff anymore, conduct, it's, you know, those are, I've always been a fan of kind of the broader codes. But at the same time, those are often the things that didn't necessarily end up with the most severe sanctions, but they may be the things that we're focusing on the most. And so how do we work with that within, you know, you have students, you know, particularly returning students who have a set expectation for what housing is and what that life looks like, even if we're trying to tell them that it's going to be different. How do you approach that? And even from a sanctioning perspective, how do you, if someone violates that policy on failure to comply, and what if that failure to comply is they didn't wear a mask? Like, how do we approach those, and how do we, you know, effectively deal with that within, you know, from a sanctioning perspective too?
Yeah, I think that's the sort of weeds that I'm really interested in. You know, what I like to say, what I think about, I'm going to try to paint a big picture. big point picture. When we think about universities and effectuating consequential policies and practices, it's much different in a university than at like a Whole Foods or a Walmart. There's consensus building and all of that sort of stuff. And universities are so diffuse that you need to touch, as many in a non-Title IX way, stakeholders as possible to seek their input. And so I guess part of my concern here is, and I was in New Orleans post-Katrina, and I thought that was like the most monumental risk management challenge, getting schools reopened in January after Katrina. But this is like an enormous risk management project. It's probably the most complicated risk management project I've ever seen in 20 years of doing this. And so what I'm concerned is going to happen is we're going to spend, let's say 2 months in developing protocols for how to manage this risk. And then how we get from the plan to implementation is just going to be, rushed through really quickly. So Sean, when you're talking about that, I'm thinking about, we would have to have like really comprehensive and new orientation training for new students and existing students. The rules are going to be different. Training for our residence hall, our residence life staff about what the expectations are, what the rules are going to be, when will we intervene, what does intervention look like, all of that sort of stuff. So I think my concern is that the planning at the high level is going to take probably 2 months, and that boy, there's going to be this mad rush to implement. And at some level, what I've tried to say is get these people in student conduct, get these people in housing as part of the conversation now, because whatever grand ideas you come up with, it's ultimately going to be left for them to implement. And the worst thing we can do is come up with an idea or a rule, and I'm seeing some of this in the questions and comments, that on a practical level as an institution, we cannot enforce, right? Either because we don't have the personnel or whatever the case may be. So those are sort of my big picture concerns. We're going to spend 6-7 weeks now developing big picture plans. And at some point, we're going to switch on a dime and have to implement very, very quickly.
And my response to that also is looking at it from a perspective of, does everything have to be a policy related answer? Because what you were talking about as far as community values, there's so much in residential life and education that we talk about as far as community building, responsibility to each other. How do you live with each other? Community creeds. There's restorative justice, community circles. There's so many different ways to address this that doesn't have to be a hard policy conduct answer. And so the humanity pieces that we can talk about, the impact to others that are living in the community, I think are the ways that I would like to address that. Some students only, some situations may need to be formalized conduct, but I would say that the majority, I would hope, could be a community effort as part of those educational health and wellness initiatives, but then also looking at it from a community growth and responsibility factor.
Great, no, that's a good point. It does go to that kind of core educational mission too of the residential life professionals. Beyond just the written policy, but in terms of it really, Scott referencing how what a challenge this is, but this is really putting putting our money where our mouth is in terms of community building, and what that means. That it can't be a platitude, and that's not something I'm not suggesting. Obviously, that's what we feel like it is. But I think sometimes too, when particularly student affairs divisions are kind of justifying what we do, that's sometimes the view from outside is that, well, what is this? It's all kind of squishy. How do we assess that and things along those lines? But but community buy-in is going to be a huge part of that.
Well, and
Go ahead.
just one other thing, though, to come back to this policy issue is that I've been on conversations about, do we change our lease, our agreement, our housing contract? What is that supposed to look like? Are there terms and conditions that we need to put in for extreme community health concerns, as well as changing residence hall policies and also codes of conduct? And I think that, those things, when you're starting to change some of those documents that are supposed to be living documents, but then documents that are timeless in some way, I'm thinking residence hall policies at most institutions are a little bit more fluid, but when you get to changing code of conduct to specific pandemic level topics, I think that is problematic at a lot of institutions. We're looking at things such as immunizations. Do we change our immunization to live on campus? And if they don't do that, is there any kind of, can we deny them on campus living? So there's a lot of things that I think that are going on that, as Scott talked about, huge risk management, huge unanswered questions.
Jacinda, you brought up about this issue of not just beyond the codes of conduct, but talking about housing contracts and maybe other agreements that we have in place. What is, obviously, if we're making significant changes in what our expectations are in the kind of that agreement between the student and the college and or the university in terms of what you're agreeing to live on campus, how do you view communicating that to students? In particular, I think me being up in New York, it's New York's we have some pretty heavy state and local government involvement going on with what we're doing. And we anticipate the local health department to have a big say in if we report a case, what we're going to be doing. And they just may say, this is what happens. This is what you have to do with your students. And, we're thinking about how do we communicate that to our students. And, to give an example, the state of Connecticut put out in some of the governor's office put out a report on higher ed and reopening. And, one of their pieces talks about, okay, we're going to allow multi-unit student housing, but if the students agree that they will be treated as a family unit for terms of isolation and quarantine and things along those lines. But that's something that sometimes students may sign and not realize by thinking what that means. If their suite mate gets exposed, then you're all under the same conditions. So how do we talk about that with students, particularly now when everyone's kind of, not only are we online, but the semesters are ending and they're kind of diffusing out in terms of this, not even physically, but just their attention with the institution.
Yeah, so Holly in the chat raised a question, and I'm going to get in trouble. So it's just one person's opinion, and I'm not trying to, if your counsel, in-house counsel or external counsel has a different opinion, I'm sorry, this is just my opinion. So the question is about, I'm hearing a lot of schools talk about, for instance, before coming to campus or living in a residence hall, we're going to have students sign off on a release agreement, releasing us of liability. So I will give you my perspective. This is where I'm going to get in trouble. One person's perspective. I'm not a fan. I have a ton of misgivings, first off, about just the enforceability of something like that. And this now bleeds into Sean's question, like, what do I propose as an alternative? What I propose is being honest and open and transparent with our students and community members about what are the risks of returning to campus and what are the steps that we can do to mitigate risk and that we're committed to do. And by the way, if we commit to do it, we need to do it. And then being really clear that there's no way, there's nothing we can do that will eliminate the risk of someone on our campus contracting this virus. We can take all the reasonable steps. And so are you willing to come back and assume that risk? And so I'm a big believer in being really honest and transparent in our communications. What does that look like in form? Who's doing it well? Look, there are a couple of schools. I'm on their email list. I get regular updates from the president or the provost via video. It's 2 or 3 minute little snippets of information. I find that really helpful. But I just think what we need to be doing is being honest with community members. So I think reopening is going to happen at the bulk of campuses where I work. And I just think we need to be really open and honest about, what are the risks? What are we doing to mitigate those risks so that people make informed decisions? I think that is a lot better plan than what I view as sort of a ham-handed attempt to get people to sign off on liability waivers. And I think there are a variety of ways to communicate that sort of information to students so that parents and students can make informed decisions about whether to return or not.
I could speak a little bit about that. So the liability waiver, we have not gone down that path, but we are in the process of kind of developing some cleanliness standards, or making sure that students are aware that they're responsible for cleaning and sanitizing their individual residence hall space, and making sure that before they check in the campus that they know that that is going to be their responsibility. But also communicating with students that we are also accepting responsibility of our community spaces, community baths. This is the process that we're using. So I think having that clear communication with students and being, like Scott said, open and honest is how you build some of that trust with the students, and ensuring that everybody is doing their best to make sure that the student safety is at the top. In addition to that, just thinking about just making sure with those acknowledgements, one of the main questions that I ask is like, so if a student doesn't acknowledge, are we going to tell them they can't move in? So that's one of the major caveats to having some of those type of processes is if a student doesn't follow that process, what type of teeth or what type of accountability does the student get if they don't follow through with those type of measures?
Well, thanks, Doug. And I think one of the, and it goes back to one of Scott's earlier points in terms of, not keeping all the conversations about reopening kind of up here, and really kind of getting down into some of the more specific functions. And I think housing and res life are maybe one of the most important ones to do that deep dive in. And, speaking of my own institution, and, I just submitted a draft of a reopening plan, or at least things that we think we have a handle on, things that we need to make decisions about, things along those lines, through our emergency management team. And, we had kind of broken up into subgroups and intentionally invited people who aren't on that overall team into those conversations to talk about those matters. And so, things that filtered into our overall report are, were things that I think when we first started, I wasn't even thinking about. You referenced about cleanliness. It's like, well, how are we doing our semesterly health and safety inspections? Like, what's the process for that? And even something as mundane as what's your lockout procedure? It's if you don't want to, if you're trying to protect social distancing and not wanting, if you don't want to have student employees doing that, and is your campus safety or police able to do that? Those are all, especially if it's not something part of the CURD function. How do we trade some of these things on and off from department to department? It's not the most, scintillating part of the work that we do, but it's, as Scott talked about, when we hit that point from plan to action, or maybe some of those small things are things that are going to fall apart very quickly, and we're not, because we weren't thinking about them. And Doug, actually, one of the questions posed was asking a question about University of Houston, and that you've done a dry run, or you've tried to do any kind of, can you talk about that a little bit in terms of what the experience of the institution's been?
Yeah, so we have a large first generation college student population here at the University of Houston. So we remained open when our instruction went online. We did not close our residential facilities. We gave students the option, if they wanted to move off campus if they chose to. And about half of the students took us up on that. So we were about half full all the way up until early May is when our numbers started dwindling down. And of course, we're closed for the spring now. So a lot of things that we had thought about as far as community building, moving all of our interaction with students from in-person to virtually, we've done that. So we've had practice on that. Holding students accountable, we still have to shore up some of our policy infractions, how we kind of address those. But we heard our conduct cases via Zoom. We were very accommodating to students who couldn't meet with us. But we also had our in-hall staffs remained and met with students if the student and the staff member felt comfortable, which we kind of forced students to try to meet with us via Zoom, and we tried not to meet with any students in person. But we had about close to 2,000 students who remained on campus during the peak of our stay-at-home orders that were here in Texas. Now, the thing that has been very probably different here in Texas than other states is that we are now slowly opening up. And I think one of the things that has been very clear is that our governor is providing a lot of guidance on what you have to do in order to open up. But with that, some of that is not incongruent with what our city wants us to do and what even our county here in Houston wants us to do. So I think those are a lot of the push and pull that are at play. And I think one of the things, especially with new professionals within the field, you want an immediate answer to every question that you may have. And today, the way this situation has gone, like, it has taught me to be patient, because a lot of answers are a whole lot more complex and require a whole lot more consensus building than just your director of residence life saying, yes, do it that way. Because there's a lot of even mundane things that you would expect an immediate answer for that has to go all the way up to your president, even community relations to talk with the city, that usually would not take that much time.
I need to learn how to be more patient. I'm going to come hang out with you in Houston, because I haven't figured that one out. Do we meditate? Is that what we have to do?
Well, I think one of the questions I saw come through that I thought was, particularly important is talking about health and wellness, and particularly where we may be running a situation where we don't have kind of physical eyes in the hall as much as we usually do. There may not be that face-to-face interaction we see with our paraprofessionals or professional staff. That would be the old normal. So what is the best way to think about planning for a situation where you may have an in-person health services, but maybe all counseling is telehealth? And what about when you have kind of throwing in there some of the traditional AOD issues we deal with particularly in a residential environment, and a lot of those sanctions and programs that institutions use are very much in person for students who are from low-level alcohol violations to really, like, you need to get try to connect a student to some real serious addiction help that an institution may provide or may be outsourced out, and those providers may not be available anymore or maybe shut down for the time period. How do we, from a housing and student behavioral standpoint, how do we look at approaching that in the fall?
Boy, so I'll chip in just quickly. I found out literally about 30 minutes before this whole thing started that a former colleague of mine had committed suicide. And, he had had struggles with depression, but the sort of the overwhelming nature of this, I suspect, I don't know, is what, really took him and took his depression to that level. And I do worry about, what, like when whatever experience we have in the fall, it ain't going to be the same experience we had in the fall of the preceding year. It's not going to be a cheery necessarily place to be. I mean, it's, these precautions. I go to the grocery store now, everybody's wearing masks, their lines, all that sort of stuff. You can expect more of the same on campus. And no, I do worry about the mental health aspects of that. I also worry about, I do work with student health centers. They're going to be completely overrun with the assortment of challenges that are now on their plate in terms of testing. I mean, here schools talking about contact tracing. I go, how in the heck are you going to do that? Who's going to do it, more importantly, and what's the staffing for it? So yeah, I worry about student health centers. I worry about the mental health of our students. And again, I think we need to be thinking about those things and in due course be fully transparent with folks about what a return to campus looks like. It's not going to be what it looked like certainly 2 years ago or last fall, and what resources we will have available and what we won't have available. Sean, I will say this, I mean, I think there are ways to access technology now that frankly did not exist prior to this pandemic. Telehealth, telemedicine has been an enormous breakthrough. If there's ever a positive thing that comes from this, it's that we can now access, whether it's psychiatric help, psychological help, other health concerns, we can access those folks online. We don't have to leave our room. And so I've been asking schools, do we have these protocols in place to be able to do it? And if it's not with our school providers, do we have MOUs in place with other organizations? Because yeah, I do think, I think if you're predisposed to depression to begin with, this has not been a good couple of months. And I worry, a return to campus and how isolating that may be for a lot of students may exacerbate those conditions as well.
Just to add to that, I think that we have one mental health counselor on campus. Telecounseling, there's, I learned this, and I'm sure other folks knew out there, of different ways telecounseling can be insured by your institution and how you can do that. I learned a lot about how licensure and insurance and everything works about with counseling, but also looking at when you have those relationships and those MOUs and those referral pieces, and then they stop seeing patients also, it's very challenging. I've had many students tell me, and I don't know the answer to this, I'll be straight, they are so depressed they can't even log on. So telecounseling, teledoctor or telemedicine doesn't work for everyone. And so that's what I'm struggling with right now. And I know that there's probably not an answer to that. But our students that are struggling the most, we're primarily a commuter school. So there's no way we can have somebody just stop by and check on them, knock on their door. And I think that that's going to be a challenge and something we're going to have to think about long term, and getting faculty really connected to that. How long has it been since you've heard from somebody? When do you report that? That has been our approach so far is, when is the last time the student logged into class, trying to do some attendance checking there. But I think that's one of my biggest struggles for this next year.
Yeah, and the issues that are, I think one of the things we've discussed, at least on my campus, is issues related to information sharing. And given that we may have, it was brought up earlier about things like testing and temperature taking, and who has access to that information, and where are the, if you're doing contact tracing on campus, or even if you have to work with your local health department, in a recent conversation I had, it's like we need we have to break down silos and make sure that some information is very readily accessible, from everything from housing rosters to class rosters to, sports team rosters to, and maybe putting those all in one place to, also you think about employees too, with, shift schedules and things like that, especially now that we're likely going to be seeing a lot more spread out, low density workplaces. And yeah, it's a struggle. Going to one of the questions, that kind of was related to that testing piece is, are there concerns about, one of the things I think we need to think about in terms of our work is that, we're not just talking about students anymore, we're talking about everybody. When it comes to tracing and contact tracing and testing, it's the whole community. There's no real operative difference between employees and students because everyone's in the same boat. Are there concerns you have or roadblocks that you see to implementing those systems on your campus for students or employees, and what you do with the information once you get it? What's, in terms of, if you have a student that shows up and their temp is 101, what do you envision kind of moving forward from that, and how institutions react to that?
Yeah, this is, so I saw Holly ask this question. So again, I have a perspective on this, and there's been a lot of conversation about the idea of, as institutions, we're going to take on contact tracing. Sean, you hit the nail on the head. In other words, if we have a student on our campus who tests positive for COVID, so testing's not going to be an issue come the fall. I think we're going to be fine on testing, availability of testing. There have been a lot of developments in that regard, and there will continue to be. But when a student tests positive, the public health intervention is, you identify them, you look at their contacts, and then you communicate with them so that they can isolate and don't infect other people. That's kind of the public health intervention here. And Sean's point's exactly right. If you're in a community like Austin, where I am, I mean, the contacts for most students who test positive are primarily going to be in the community. I mean, there will certainly be some on campus, but there'll also be in the community as well. And should an institution be taking that sort of that initiative on? And I have to be honest with you, I'm not a big fan of the prospects of doing that for a variety of reasons. I do think that the better plan for contact tracing is right now looking at your public health officials in your community and game planning with them pursuant to an MOU or whatever the case may be. Hey, come fall, we're going to have 5,000 students coming back to campus. We want to make sure we have a rigorous contact tracing program in place, not only for our campus, but the community. Let's team up working on an MOU, accessing technology to make sure that we do that. But I don't know how you can do, I'll just be blunt, I don't know how you can have a comprehensive contact tracing program and do it as a university or a college alone. It has to be, at least in my opinion, I could be missing something, be done in concert and frankly, in my opinion, directed by local public health folks for that sort of program to be effective.
Great. Well, anyone else have anything to throw into that before I move on? I know we're in our last 15 minutes, and there were a couple points. One I want to bring up just because there's been a lot of questions about it in the Q&A, so I want to acknowledge it. And there's been a lot of questions about masks. And I think it's important to acknowledge too that we are, I think we are, colleges and universities are not immune from kind of the culture wars that are going on right now. And we're very much in it. College universities are in the middle of culture wars going on really in America right now. And masks are a big symbol of that. And when we return, there will likely be the first day we start up, is there will be, especially if your campus has, or your local community even has a mask mandate, there will be these students who say, I refuse to wear them. And so how do we approach that? And there may be some differences too. I mean, there's a public-private issue there too sometimes, but in a general sense, there's we're also going to see some areas of the country that have a more stricter governmental mandates on that, and others that don't. So you may be the institution, maybe an island within a community that's not requiring. So how do you navigate that? And because the thing is, it's going to be often our frontline staff, though, the ones that are dealing with that on the front end. It's going to be the hall directors and our paraprofessionals and other residential life staff and student affairs folks, who may be the ones who are kind of the first contact there. So how do you envision that, and are there solutions at this point, or do we not know yet?
I can kind of speak to that because I think here in Texas has been really interesting. Our county judge had made a mandate that everybody is supposed to wear masks in the city of Houston and Harris County into a specific date. And then 2 days later, our governor said that my order supersedes all orders and masks are not required. So it really has been, we follow the directive of we try to support our local government, because this is the area we pride ourselves as being Houston's university. So we're following what our county judge is saying about masks, which that order is set to expire at the end of this month. But with that, if a student is around our residential facility and does not have masks, we have masks available at our front desk, and we'll say, hey, do you want a mask? Here you go. So what we did was we bought a surplus of masks, and we had masks donated to us as well that we had at our front desk available. But we were not documenting students, or we were not reporting students if they did not follow that order. But if a university official, like if our chancellor would have says everybody needs to wear a mask, then if they fail to do that, that's failure to comply with the university official. So that's how we will operate that. But it's interesting because we have not had this discussion moving forward towards the fall about whether we're going to require masks, and if so, are we going to supply masks to students? I think we will have a surplus of masks at our front desk if a student wants some, but I don't know if we're going to mandate students walk around with masks at this point in time.
I would agree with Doug. Our campus is looking into a lot of those safety measures. We've even been looking into branding them Stetson masks, making them kind of school spirity, more so like the fishing and hooded kind of things to you bring it all the way up. But we're looking at options, and whether or not we mandate it, exactly like Doug said, we want students to feel as safe as possible, and so we're looking at what kind of masks and other ways that we can ease some of that transition and that anxiety for them.
Yeah, I'll just chip in quickly. I mean, look, the culture war stuff drives me up the wall. And if you follow me on Twitter, you'll get a flavor for that. What you hope is that whatever interventions we have are informed by the research of public health experts. And I feel like the research on the effectiveness of wearing masks as a risk mitigation for the spread of virus is about as universal as you could possibly get. I mean, and it's obvious. You don't even have to be an epidemiologist or a public health expert or a doctor to get the idea that if you put something on your face and you cough, there is a chance that a lot of that is going to stay in the mask and not into the grocery store, the res hall, or whatever. So I get it. Like I think for private institutions, the calls will be less political. They can make a decision about whether or not, from a public health perspective, this makes sense. In some red states, the conversation might be a little difficult which just makes my head spin for public institutions. And then the question is, if that is going to be the rule, I mean, what does enforcement look like in that space? Are we going to, drop the hammer to say, if you're out in public without a mask, or you're at the residence hall, common area without a mask, we're going to go through a student conduct process? Or is it more trying to convince and persuade, or is it a combination of all those things? I just hope whatever we end up with in terms of interventions, that the primary motivator is what's supported by the public health research as reducing incidence, right?
Right. And yeah, and it's funny, you talk about that enforcement piece and what the result is. And I think that's one of the more difficult things that everyone's gonna have to that needle to thread, just because everyone's stressed out. And so we're gonna have institutions that are not in the mood to have long drawn out conversations about where you should or shouldn't be. They're just gonna want students to say, do it. And students aren't going to do that. And everyone's really kind of suffering from that quarantine fatigue that we're seeing some more media articles talk about. But it's on institutions to really look at what's the best way to approach enforcement of that. And it's again, maybe leaning back on kind of those educational roots of student affairs, and not just looking at every being a hammer and every problem being a nail, but how do we approach that in a way that maybe promotes some understanding, where it's in a time and a space that may be difficult to get to that point. So I'm going to throw one more question out there, then a final wrap up. This one being looking outside the community, and Scott referenced it a little bit already, but talking about that relationship between the campus and your surrounding community. And we've seen already, obviously, there's been a big, as campuses have vacated, that's had a negative economic impact, obviously, on a lot of communities with colleges in them. But at the same time, there may be strife the other way when students return, and if the community sees that the college students are not abiding by expectations, somebody throws a huge party off campus, or something that happens on campus then leaks out into the community, becomes an issue, and then you're obviously having maybe first responders or law enforcement or folks who are engaging in things that they would rather not, because they're trying to keep social distance and whatnot. What's that approach too? Because there may be that that desire to let off steam, and that may happen not on the campus. It may happen somewhere outside. And what's that approach there? I mean, we have enforcement mechanisms for that for the most part already built. So what are the other ways we kind of look at that, from an educational and developmental standpoint?
Well, I think one of the considerations again is trying to figure out how you come together with some sort of reasonability, because if life on campus is at one level of expectation that is extreme, then you are going to push things to off campus, right? So if you haven't had any conversations, and of course we already saw this manifest in the differences between how private student housing managed the go home kind of orders that campuses did, and kind of pitted the institution and the P3s in some cases against one another. We're going to see that in our neighborhoods. We're going to see that with the local police departments. If what we're trying to do on our campus is so juxtaposed against life just feet off the campus, we're going to have conflict that just is counterproductive for us. And we also have to remember the long-term ramifications of our decision making, right? How we decide. If we change a policy today, we have to be ready to live with that policy for quite some time. And the same kind of thing, if we choose to say, well, we don't care what's happening in our town or community, we're going to do this on our campus, that's going to have some long-term ramifications. So just, it is not an easy thing to do, but as you're trying to determine what might be reasonable, You also have to determine, is it reasonable to think that we can deliver our core mission, right? Educating students, having classroom activity, having civic responsibility being taught in our resident communities, doing more than COVID-related work. This is why you're going to see potentially more campuses ultimately say, we can't. We're so concentrated, you know, whether that was in the minds of the leadership of the California State University system or not. We have to be able to set up an environment where we can deliver something that's realistically long-term. And it can't just be a bastion of 90 acres in the middle of a city where life looks like this and everywhere else it looks like something else. It's a big challenge.
Good point, John. Thank you. The last thing I'll throw out to everybody, just to, you know, it's a big question and I'm asking for a short answer. So what do things look like in the fall? If you're going to make some thoughts right now, some predictions right now, what do things look like? And I guess when I'm asking that question, I mean, what are the things that you think will maybe be markedly different than what we're, you know, or maybe they won't be. Maybe there's an eternal optimist in the group. So what are your thoughts on that?
Yeah, I'll just go quickly. At least for me, I see the bulk of campuses opening up in some form for on-campus, you know, and some of that students, there will be a healthy percentage of students who aren't comfortable with that, but there will be, I think for the vast majority of universities, colleges, on-campus classes. I think one of the interesting developments that I'm seeing over and over again, especially this week, and it's been a conversation I've had with folks as well, is around timing and how long the semester lasts, and do we cut it off? I think at Notre Dame, for instance, they're cutting it off at a point, I think it's before Thanksgiving, all that sort of stuff. So it'll be different. I mean, there'll be probably a shorter semester, fewer students, that sort of stuff. You know, some strange things. It's sort of like going to the grocery store, but I would imagine the majority of schools will be open in some form in the fall.
I would say one of the things that is going to be really interesting is just how institutions really interact with students who do have some of those mental health concerns that may typically have resources for regarding their behavioral intervention team, and having a group of people really be that safety net and assist that student to navigate through their college experience, and having that to be a virtual or a some sort of social distant type of engagement. I'm really concerned about how those students continue to matriculate through our campus, and even conduct processes or behavior intervention processes, because they're going to look vastly different moving forward.
And I would say, as I said before, guests, visitors, that's going to look totally different on my campus. But kind of what Doug was saying, not just those that need our help come up on our list to discuss for behavioral intervention. Engagement in general is going to be really different. We're trying to make the conversations right now. How do we do programming? How do we have student orgs? How do we make our first year students feel engaged and part of the community when the community is not what they expected? And so those are some of the things that we're looking at right now, of how can we make a new normal feel like a college experience.
John?
Given the time, I guess I would say my last answer probably gave some, and I think we also need to think about our colleagues and accessibility resources, and the number of accommodations that are going to be coming through on all sides of this. and the equity issue coming up possibly more so than ever before around the equitable experience of faculty, staff, and students. I know on our campus, we are a traditional age college student campus almost exclusively. So the tension points of asking a faculty member to be in the classroom, the questions around staff expectations of one another, I think, it's going to be a really challenging environment to try to figure out how do we civilly navigate conflict.
Thank you, everybody. I see Jennifer is back, which means that we're at our end.
We are at our end. So I want to thank, Sean, Doug, John, Scott, and Jacinda for spending an hour talking about this. I know there were lots of questions in the question boxes. I would like to say at some point, maybe we come back together again. I think these are conversations that are going to continue because I think as we set off at the very beginning, there are not a whole lot of answers right now, and these conversations are continuing. Information is evolving. Location makes a huge impact on, I think, what campuses are going to do. But on that note, a big thank you to everyone. Thank you for everyone joining us. I greatly appreciate you taking the time to be part of the conversation and ask questions. Have a great week. Hopefully folks will have a great Memorial Day weekend coming up. Take some time to refresh. I'd say go outside, but I think it depends on where you're at. Thanks, everyone.
Thank you all.
Thanks, everybody.